Hello, it is day 12 of our Winter Wellbeing Advent Calendar. And I thought something that is very appropriate for writers at this time of the year, but also anyone who suffers with really cold hands. So maybe Raynaud's disease, if you've got carpal tunnel syndrome, poor circulation, diabetes, that doing a lovely self hand massage is a really nice way to get the circulation going in your hands and your forearms. What you're going to need is, if you have a soft, small massage ball, so sort of tennis ball size or smaller, great. If not, a tennis ball will be perfectly adequate. Now I'm going to tilt the camera down so that you can see. There we go. Okay, so you want to have your forearm exposed, and you're going to begin by just placing your little finger on the edge of the ball and rolling. Now you can go further if you want. You could go almost to the elbow, but don't go right into the elbow. Just gliding along. And this is a lovely mindful thing to do as well. And then we're going to go into the front. I'm not putting too much pressure on, but I'm trying to keep it fairly even as I go. And then towards the thumb side. So this might be a little bit more awkward. It might be something that you want to do on a table rather than kneeling on the floor. Okay, now we're going to take the hand and just gently press down the center of your palm onto the top of that ball. So when we're doing this, we are allowing the fascia, the connective tissue, to adapt to the sensation. So maybe you're starting to feel a little bit of warmth in the palm of your hand. And I want you to try and keep that pressure even and go all the way around. So all across the ball of the hand. So that's where your fingers join the palm, the fleshy part of the thumb, and right the way round. You could do this after you've put a nice warming aromatherapy treatment on. So something with maybe ginger or rosemary in it would be great for your circulation. Now we're going to do exactly the same, but going the other way around, because our hands are lumpy and bumpy, and sometimes when we go only in one direction, we miss bits out. And then right into the middle of the palm and just little circles, both directions. Okay, now we're going to glide along the thumb. If this does feel really uncomfortable at all, or it is actually causing pain, obviously stop. And it might be that you just need a softer ball if you're using a tennis ball. And then into the first finger. And the middle finger. It's hard sometimes to do this slowly, so maybe put some nice relaxing music on, because the tendency is, if our brains are feeling a bit busy, we sort of speed up. Okay, ring finger, your fourth finger. And then your little finger. Now we're going back to the palm, and we're going to go nice and quickly. Round and round and round, and round the other way. And then just squeeze the ball and stretch your fingers out. Take a deep breath in and relax. Give it a shake out. Okay, we're going to turn the palm up and just gently find that little spot between this fleshy part here and the fleshy part of your thumb, and just little circles in there. Remember both directions. And then into the knuckle of the little finger. And just work your way along. This bit you could always get somebody else to do for you. And then into the fleshy bit of the thumb. Okay, now give each finger a little pull. And you want to pull it from the end of the finger so that each joint just gets a bit of space, because sometimes they can get a little bit compressed. So if you just stretch and wriggle, not too hard, but just enough to feel that your finger sort of lengthens a little. And then a really nice way to finish that off would be a little soak in some Epsom salts, and then maybe finishing again with your lovely warming hand oil.